Hello, doctor. How are you?
I'm good. Good to hear from
Uh,
you. Yeah.
likewise,
Long
likewise.
time.
I hope you're keeping yourself safe and sound.
Yes, we go to work every day. We are in healthcare, right?
Yes, I can only imagine. And is the hospital keeping you busy over there in Kannur?
Yep, very much. So. Very much.
Excellent. So we won't take up much of your time, Doctor. The objective of this call is to really talk about how the Indian workplace has changed, given the COVID times that we are all in. So I have a bunch of very short, quick questions, and I'd love to just start off by talking about how you believe that the Indian workplace has changed or should change post the whole COVID-19 and this particular lockdown.
Okay, so, much as we may think that, okay, it's a very unfortunate situation that this has happened, but yes, a lot of things has to change. One is that we all have realized that we need to be more careful about our health. And I think there is no other time than now that everybody should realize that that is very important to look after ourselves. Now, what will happen and what has been, our experience with lockdown, and all of us have learned that a lot of us can work from home. So it's not really necessary to go to workplace unnecessarily. So that is one. The other thing is that the workplace, the culture will change. One is everybody will be afraid. And I think that fear, we should not be so afraid. That's what I'd like to say. We have to be careful. See, there is nothing to be gained by being afraid of COVID. It is like any other influenza. Only thing is that this is a little more aggressive and it's a little more, and it spreads very fast. It spreads when we are asymptomatic and pre-symptomatic. So our best friend sitting next to us may be the person who will pass on the virus to us. So that is something that we have to be careful about. So what will change is that lesser people will be asked to come to work. The large office spaces will have fewer workforce. But what is extremely important for all of us to realize is that there are things to prevent the spread of this virus is in our hands. And we need to just make sure that we prevent exposing ourselves by making sure that we follow hand hygiene, we wear masks, and we follow social distancing. So one thing, of course, that will change is that we will forget how our friends look like because we will be speaking to people under the masks. So that will change. Employers have to be more responsible. They have to consider occupational safety of the employees as an important aspect of workplace.
Great. And what, according to you, might be the concerns of most people going back to work? I mean, the general population, maybe you can put it in the context of both the blue collar worker as well as the white collar worker.
See, whether blue collar or white collar worker, everybody's concern is today, I mean, everybody's just afraid. And that is writ large on people's faces, when they get out of the house, when they are with people, when they want to go to work. It is a fear that is a predominant thing. Everybody is afraid. They don't know what will happen. They wouldn't know whether they have caught the virus or not, and they are afraid what will happen if they fall ill. So that's a predominant
Sure,
concern. Yeah.
sure. And from an employer perspective, what do you think the employers must do to address the employee concerns and maybe providing a healthier environment?
That the employers must do. See, the employers must make sure that occupational safety of every employee is important. And in these times, they must provide adequate places for hand hygiene. They must ensure that every employee wears a mask. They must ensure that there is no crowding. There are no meetings which are happening, with people at a close proximity. They must rearrange maybe the seating and the workplace, layout and design. And they need to provide the adequate barriers to, prevent this kind of exposure. And as much as possible, people will have to go online. People have to do online meetings. I mean, this is how we all, I mean, we have been working continuously throughout the lockdown because we are a hospital. But we have stopped all those activities of so-called team building and all. Now team building happens online. We have to start addressing all these kind of things. We have to stop having meetings and large gatherings of crowds.
And, therefore, we've been seeing that, from most Indian employees' perspective, those who are getting into the work pool right now and they are trying to choose employers, one of the criteria for them to choose that employer is to see how seriously does that employer take workplace healthcare. Do you believe that that's something that's going to be a necessary criteria going forward?
A lot of them will look at it because I do know that a lot of families would not allow uh, their folk from going to work where they are at risk of getting the infection. So the families would be concerned. So even if, let's say, even if I'm going for a job and I say that okay, doesn't matter, I'll go and pick up a job anyway. Because see, one of the things that has happened recently is a lot of people have either lost jobs or are getting less salaries. Their salaries have been reduced. There's been a real economic slowdown. So in that sense, a lot of people would be, they are looking for jobs. So, but one of the things that will be very important is how safe they feel the workplaces. And their immediate
Understood.
concern is about the virus. And we have to remember, these are temporary concerns. Temporary concern in the sense that this concern about this virus is only as long as we don't have the vaccine or we don't have enough herd immunity. How long that time period will last, we do not know. We hope that it is sooner than later.
So that actually it was one of my questions. From from your personal opinion point of view, when do you think that things will quote unquote get back to normal, at least in India?
See, India, I mean, more than in any other time, it has become very evident now that in India, every state, every region has got a different, they've reached a different stage in terms of their response to COVID, as also their lockdown relaxation plans. So on the one hand, you have Kerala, Goa, Bangalore, southern states, and on the other you have the middle and the northern states, and most of them uh, are in different stages. So we can't generalize it, but if I were to say that lockdown will be relaxed in graded fashion, how long and how well it will be done will depend not only on the physical density of the population, which is one of the factors that's very important in the spread of the virus, but also how dense the people are in their mind about following the regulations and having the right attitude towards it. So both those things are very essential. And hopefully, in a year or so, I see that vaccines will be there in the market because there are more than 10 vaccines that are under trial at the moment. Many countries are, trying to develop vaccines. There is a lot of effort that's happening across the world. There's a lot of solidarity in this effort in finding treatment as well as finding preventive measures in terms of vaccine. So that will happen.
Sure.
But some states will do it better than the other is what we can see.
Understood. And even for our own self, we've always had the concern, and a lot of the companies we speak to, they have this concern where, let's say, there is a phased opening up after the lockdown, 50% staff, 33% staff, etc. Does that in any way positively impact or reduce the risk of infection? Does that really have any kind of material impact on how an office space or a workplace is really going to benefit, or at least reduce the risk of transmission due to COVID?
Yes, it does. It does. If you remember, when we all started in before the lockdown, if you remember, at workplace, a lot of offices had already started doing either the one-third workforce at home or 50% of the workforce at home. And this was with the idea that at all given times, when you have 50 people working from home and 50% at office, you could, in case any of the people who are at office turned positive, you could just allow everyone to go on home quarantine for 14 days and get the other workforce which is at home safely to work so that your work is not impacted. That's important as well. So the strategy to get people in batches is extremely important. You get either half, one third of the workforce or half the workforce, put and let half the workforce work from home. And if there is anybody turning positive, and we know that they are exposed at workplace, then you need to necessarily quarantine everybody who's at work. So when you send these people for quarantine, you call the others who are at home. And this strategy has been used by many of the employers already. And this will be an important aspect of, when we are relaxing the lockdown, how to really get back to normal.
I see. My last question. In India, the COVID testing costs, as per the government stipulated prices of rupees 4,500. So the question in most people's mind are twofold. Number one, what is this test really, and what is covered? Number two, can anyone go out there and get a test? For example, can an employer just send all of their employees to go and do this particular test? And if not, then what are the alternative low-cost tests that one could potentially look at?
So let me tell you that broadly the test can be categorized into the testing for the presence of the antigen or testing for the presence of antibody. Now, antigen means that, okay, you have you test the genetic material of the virus, and the test that you are talking about, which costs 4,500 or 5,000, is actually the RT-PCR, which is for the genetic material of the virus. Now, this test is at best gives you about 70% specificity and sensitivity. Okay. So there are few cases which may be in the pre-symptomatic phase and have the virus, but they need not necessarily test positive, because very early on it may not test positive. And even later on, it is possible that you miss some of these. Now, the antibody test becomes positive after 7 to 10 days. And it actually just indicates that you've had the exposure to virus, which means, in other words, that you are likely to have immunity. Now, it has been proven that it is not necessary that it gives you, immunity from reinfection 100%. There are people which have got reinfected after being RT-PCR negative. So the tests need not be done in asymptomatic people. Okay. Now, that is now, because we must remember that the number of tests that we have and the capability of testing is very limited. So we cannot waste our resources. So where we expect or we suspect the person to be having COVID-19 infection, who's at high risk, we can test those, which is those people who are symptomatic. And that has been the strategy till now. But when we are going to relax the lockdown situation, there will be a lot of asymptomatic carriers who are going to spread the infection to the other vulnerable population. So it might become a tool for people to say that, okay, I would like to test the people who are coming back to work. And if there is somebody positive, I'd like to send the person back home and allow the person to come back after quarantine or when the RT-PCR is negative. So that is a strategy that some people could employ. The other thing that people are likely to employ is to also check the presence of antibodies. Now, if somebody is antibody positive, it is safer to assume that this person has had infection and the person is not likely to spread infection to the others. Although the small risk that the person can get reinfected is there, but that's a smaller risk compared to the larger risk of not knowing anything about anybody. So it is likely that the workplaces will employ both the strategies. Now, if you're working in a hospital, these strategies would again be very important, because We would also want to, test our staff to say whether they've been exposed and they are antibody positive or negative, so that you can stratify the risk of an employee getting the infection from a patient that comes. So in the healthcare workforce, how they will be tested is slightly different from how the rest of the workplace needs to be tested. So although there is no um, reasonable justification in testing the entire population with RT-PCR, some of the employers may want this criteria, and where a lot of people are working in a, let's say in an industry where a lot of outsiders come and are exposed, like a hotel or a restaurant, things may be different from where there are the fixed number of population, the same people come every day to work. So where you are having different people coming every day and you don't know who they are, things will be different. But let's say in an IT industry or an IT park where the same people come every day, there are not uh, many differences. These strategies have to be different.
Understood. Thank you so much. Any final words, one sentence message out to the Indian employers, the Indian, corporates out there?
See, I would say don't be afraid. Okay, fear is not what is going to take us through this. We need to balance the way we need to strategize. We need to understand the virus. You see, you cannot win the battle without understanding the enemy. And if we think that virus is the enemy, let's understand that it is like other coronaviruses, more spreading more rapidly, and we need to wait till the vaccine is developed. So look at so till that time, our strategy has to be prevent exposure. Wear mask, wash hands, social distancing. I don't think there is anything other than this that should be really a matter of concern. If we follow these three things, until then, until the time that we develop herd immunity, I think we should be fine. So we need to
Great.
be we need to be, I'm not saying that we have to be careless. We need to be very, very careful and make a balanced strategy.
Great. Thank you so much, Dr. Uma, for your time and for your insights. We know that you have to get back to the hospital that you're running in Kerala.
We are anyway better off in Kerala, isn't it, compared to other places in the world at this moment.
Yes. Yeah. Thank you so much, Doctor. It's always a pleasure talking to you.
Thank you. All right. Okay, bye-bye.